Prevention and cardiac imaging are two passions of mine. Using cardiac imaging helps us identify patients earlier for prevention measures so they have better outcomes. We can use these cardiac imaging tools for risk assessment. So in patients that have high risk, whether it be a family history of coronary disease, other risk factors that contribute to coronary disease, it's very important for us to find that early. So we use techniques with CT. One's called a coronary artery calcium score. We're able to identify the burden of calcified plaque, and if elevated, might help some treatment decisions on if we initiate a medication earlier or do we do stress testing in certain people that are asymptomatic. So advances in technology for early detection include coronary plaque imaging. We're now able to see what those plaques are composed of. There's a composition that does make a plaque more vulnerable to causing a heart attack, and identifying those plaques earlier may be the most important assessment we make in these patients. Cardiac imaging can be important for treatment planning. For example, if a patient has breast cancer, the chemotherapy agents that they may receive might affect heart function. So it's very critical to know what their heart function is before starting these drugs and then monitoring them over time to make sure their heart stays safe. We are now able to, with advanced cardiac imaging, plan for procedures before they happen. Typically in the past, we'd have to make decisions inside a cath lab on what we do and what we use. Now we can go in knowing exactly what tools we need for the therapies we use. When patients have disease, we need to monitor that over time. Monitoring that can be very critical to make sure we're using the right medications, that we're doing the right procedures for that patient to have the best outcome possible.